We have a clinical example, 18-year-old female who was seen at the clinical course for urine retention for the last 4 years. In the past, she used to have periods when she would not urinate for days. She would be taken to the hospital and catheterized. In a few days, she would return to normal. This happened many times, and finally, she had to have an abdominal catheter fixed, and slowly she learned to live with it. She lived in a shared student accommodation, cycled everywhere, and had a poor relationship with her parents, who were separated. She had recently changed doctors. Her new doctor was attending the clinical course where she was presented. His problem was that even though she attended her appointments with him, she never talked. He had to do all the asking, and she would give monosyllabic answers. He knew that she was also badly constipated, that she had only two menstrual bleedings in her life, one at 14 years of age and the second about 6 months back. She was rather obese, friendly, and really wanted to be helped. If she had not, she would not have agreed to allow her doctor to present her problems before a student group. So it was decided that she had problems with elimination in general. This was severe Qi deficiency in many organs, manifesting the worst on the urinary bladder. The large intestine governs elimination for the entire body, and tonifying the large intestine function would help to improve the functional Qi all round. So the points used were Li4, triple warmer 6, stomach 25. Together, these are called constipation points. Li4, TW6, and stomach 25. Then several box shoe points, bladder 15 for the heart, bladder 25 for Li, and bladder 28 for urinary bladder. Urinary bladder 58, the Lu point, which sedates the yin and tonifies the yang. Then paravertebral plum blossom tapping from lumbar 2 to sacrum 4, one which is located 1 cm parallel to the midline. The treatment was given 3 times weekly, and the catheter was clamped after the first week to encourage normal urination. Improvement occurred gradually. The abdominal catheter was taken out in 3 weeks, and the stools improved. She started her periods again after 2 months, but they were about 6 to 8 weeks apart. The treatment sessions were reduced slowly. She did have urine retention on and off in later years, but it always improved with acupuncture alone. The crowning glory was how, during the 3rd week of the treatment, she had her usual psychoanalysis session with her doctor, the one which had left him frustrated in the past because she would not talk. She came this time and talked and talked. The doctor was so taken aback that he canceled the next 2 patients to sit and listen to her. She had much to tell him, and all that information was useful in further diagnosis and treatment of her emotional problems. If it had not been for the correct decision to give her the elimination points and to tonify the Qi, the clinicians would never have got this far in the treatment. If our elimination processes are not in good functioning order, we cannot rid ourselves of stools, urine, heat, toxins, stifling emotions, and energy is blocked with traffic jams. Just as activity and exercise are important to keep the blood, energy, and body fluid in motion, so it is important that our elimination functions are working well too.